Marburg virus disease is a rare but highly fatal viral hemorrhagic fever caused by two zoonotic viruses, the Marburg virus and the Raven virus, that are closely related to Ebola viruses within the family Filoviridae. In February and March 2023, two distinct outbreaks of the Marburg virus were reported in Equatorial Guinea and Tanzania. Marburg virus is a highly virulent and deadly virus that belongs to the Filoviridae family, which also includes the Ebola virus. The virus was first identified in 1967, when outbreaks of hemorrhagic fever occurred simultaneously in Marburg and Frankfurt, Germany, and in Belgrade, Yugoslavia, now Serbia, among laboratory workers who had been exposed to infected African green monkeys imported from Uganda. Marburg virus is transmitted to humans through contact with infected animals, particularly fruit bats and primates, or through contact with the bodily fluids of infected people. The virus can cause severe and often fatal illness, with symptoms that include fever, chills, headache, muscle aches, and bleeding from multiple organs. There is currently no specific treatment or vaccine for the Marburg virus, and treatment primarily involves supportive care, such as maintaining fluid and electrolyte balance, managing complications, and treating secondary infections. Prevention measures include avoiding contact with infected animals or their bodily fluids, practicing good hygiene, and using appropriate personal protective equipment when caring for infected individuals. Marburg virus can cause a severe and often fatal illness known as Marburg hemorrhagic fever. The symptoms of Marburg virus infection typically appear within 5 to 10 days of exposure to the virus but can occur as early as 2 days or as late as 21 days after exposure. The symptoms may include fever, chills, headache, muscle aches, fatigue, nausea and vomiting, diarrhea, abdominal pain, chest pain, sore throat, skin rash, bleeding from multiple organs, such as the gastrointestinal tract, skin, and eyes. The severity of the symptoms can vary widely, ranging from a mild flu-like illness to severe hemorrhagic fever. In some cases, the illness can progress rapidly and lead to shock, multiple organ failure, and death. If you have been in contact with someone who may have been exposed to the Marburg virus and is experiencing any of these symptoms, seek medical attention immediately. There is currently no specific treatment or cure for the Marburg virus, and the focus of treatment is primarily supportive care. Treatment for Marburg virus infection typically involves fluid and electrolyte replacement. The patient will receive intravenous fluids to help maintain hydration and electrolyte balance. Treatment of complications. Complications, such as shock, organ failure, and secondary infections, will be treated as they arise. Symptomatic relief. Medications may be used to manage symptoms such as fever, pain, and nausea. Isolation. Patients with Marburg virus infection will be placed in isolation to prevent the spread of the virus. Experimental therapies. In some cases, experimental treatments may be used, such as antiviral drugs and convalescent plasma therapy, which involves transfusing the blood of a person who has recovered from the virus to a patient who is currently infected. Prevention is key in the management of Marburg virus infection, and measures should be taken to prevent exposure to the virus. This includes avoiding contact with infected animals or their bodily fluids, practicing good hygiene, and using appropriate personal protective equipment when caring for infected individuals. Vaccines and antiviral drugs are currently being developed and tested, but none are currently available for use in humans. Marburg virus is primarily transmitted to humans through contact with infected animals, particularly fruit bats and primates, or their bodily fluids, such as blood, urine, and feces. The virus can also be transmitted through person-to-person contact with the bodily fluids of infected individuals, including blood, saliva, vomit, and semen. Infection can occur when an individual comes into contact with contaminated surfaces, such as medical equipment, clothing, or bedding, that have been contaminated with the virus. The virus can survive on surfaces for several days under certain conditions. People who are at higher risk of contracting the virus include individuals who work with or handle infected animals, such as hunters, laboratory workers, and healthcare workers caring for infected individuals. Prevention measures include avoiding contact with infected animals or their bodily fluids, practicing good hygiene, and using appropriate personal protective equipment when caring for infected individuals. Safe burial practices are also important to prevent the spread of the virus. Vaccines and antiviral drugs are currently being developed and tested, but none are currently available for use in humans. Human-to-human transmission of the Marburg virus is primarily associated with direct contact with the blood and/or other bodily fluids of infected people. Marburg virus transmission associated with healthcare services has been reported in previous outbreaks when appropriate infection control measures were not or were inadequately implemented. Healthcare workers caring for patients with confirmed or suspected MVD should apply additional infection prevention and control measures in addition to standard precautions, to avoid contact with the patient's blood and other body fluids and with contaminated surfaces and objects. Surveillance and detection activities, including contact tracing and active case finding, should be strengthened in all affected health zones. Measures to contain outbreaks of MVD include prompt, safe and dignified burial of the deceased, identification of people who may have been in contact with someone infected with the Marburg virus and monitoring their condition for 21 days, separation of healthy and sick people to prevent further transmission, and care for confirmed patients, and maintenance of good hygiene and a clean environment. Raising awareness of the risk factors for Marburg infection and the protective measures that individuals can take to reduce human exposure to the virus are key measures to reduce human infections and deaths. WHO encourages all countries to ship samples, positive or negative, to a WHO collaborating center for confirmation. Based on the current risk assessment, WHO advises against any travel and trade restrictions with the United Republic of Tanzania. Thanks for watching. Subscribe please.